Okay, I think we're gonna get started. Welcome everyone to HCP's online webinar for January titled Compliance Resolutions, Fixing the Policy Process Gap That Trips Practices Up. Today's webinar will be led by Megan Toombs, Sales Manager at Healthcare Compliance Pros, and I'll be introducing her real quick. Megan has been with HCP for nearly 9 years and has worked closely with healthcare practices across the country, spending much of that time talking with practice managers, administrators, and compliance leads about real-world challenges of maintaining compliance in busy healthcare environments. Through those conversations, she developed a strong understanding of where compliance programs tend to break down, not because people don't care, but because translating regulatory expectations into day-to-day operations is often unclear and overwhelming. Her approach focuses on practicality, clarity, and building compliance programs that support people and processes rather than relying on policies alone. She regularly participates in educational sessions and speaking engagements focused on real-world compliance challenges, risk management, and building sustainable cultures of compliance. We are excited to have her give her presentation today. We will be doing a few polls throughout the webinar, so just watch for those on your screen. And we will also send over copies of these slides in an email to all those who registered. So with that, I'll turn the time over to you, Megan.
Awesome. Thank you, Josie. Thanks everybody for joining today. I know how busy things are this time of year, so I really appreciate you taking the time to be here with us. Like Josie said, today's webinar is focused on compliance resolutions. I want to say right up front, this isn't one of those compliance webinars where I'm going to sit here and talk about everything you're doing wrong. I actually want to talk about the challenges that people face when it comes to managing compliance, especially when it's layered on top of other responsibilities, which it usually is. So as Josie said, I'm Megan Toombs. I've spent a lot of time over the years working with people responsible for managing compliance in their organization. So I have a pretty clear picture of how hard it is, not in the day-to-day life, but really what it takes to take what's written in the regulations and apply it to real life in your practice. So I'm excited to share some of that with you today and talk through just some practical things that you can do to make your program work for you today. So we'll be definitely going through that. What I really want you to walk away with is a better understanding of why compliance feels confusing, not just what the rules say, but turning those rules into the day-to-day work and why that's challenging in real life. And talk about policies and processes, how they naturally sometimes drift apart over time, even when staff members, everyone's genuinely trying to do the right thing. And my goal today is to bring some clarity around what an effective compliance program is actually designed to do, not necessarily what it looks like on paper, but how it's meant to function in a busy healthcare environment. So, and then I also want to talk about culture, because I feel like a strong culture of compliance is one of the best risk management tools a practice can have, especially when we acknowledge that people are human, work moves fast, mistakes are sometimes made. So I'm just going to want to talk through and launch our first poll. I do also want to mention we do have our compliance expert, Nicole, with us today. And so if you guys have questions throughout, I encourage you to ask those, chime in, and we can get those answered for you. So for our first poll, I just want to get a sense of who's in the audience. So want to understand what the role is that you're in, what best describes you. So if you guys will go ahead and answer that, that'll give us a good idea. It'll either prove my point or it won't. So we'll kind of go from there. Does it show you the results, Josie, on the poll? Is there a way for us to see those, or?
Yeah, people are still adding them, so it's still,
Okay, sounds good.
they're still getting answered, but I can launch that and just the results.
Perfect. All
I
right,
shared the results.
awesome. Perfect. So yeah, it looks like we've got a good mix, mostly other, which is great. What I've found most often, and kind of what I wanted to understand is compliance is rarely a standalone role. It's something that's usually layered on top of someone else's job, whether that's on the executive team, HR, practice administrator, clinical operations, some of those other roles. And so that context is going to matter as we talk through things today. So to build on what we were just talking about in the poll, I just want to name something I hear a lot from practice managers and those managing compliance. Most often what I hear is not that it's not important. It's not that it's not on their mind. It's that it's sometimes difficult to between managing staff, schedules, patient flow, vendors, technology, provider needs on top of all that, it can sometimes get pushed to the back burner. So it's one of those things that's sometimes not top of mind. It's always important, just maybe not always urgent. Usually when people talk about the stressful part, they're saying things like it's not necessarily the responsibility itself, it's the fear of missing something. Or a common thing that we hear all the time is I don't know what I don't know. So it's hard to stay on top of regulations as they change, especially with the way technology changes, the way we work evolves over time. So it's normal for those policies and processes to drift apart over time. I want to focus on how to build a compliance program that supports that evolution instead of falling apart because of the changes. So I wanted to use an example today of a just a scenario and policy that you guys might all have dealt with, or I'm assuming that you probably have. So when it comes to staff members communicating with other staff about a patient, um, let's talk about maybe a common scenario. We'll just kind of make this up. So if something comes up, like there's a nurse in with a patient, the patient they realize that the patient's blood pressure has skyrocketed, or they're having some other type of issue. They need to act quickly, right? That's important. They need to take care of that patient. They need to make sure that they're addressing what's in front of them. So that might be reaching out to the provider. Do you want us to send this patient to the ER? Do you want us to run labs? Like, what do you want us to do in this scenario? It's a little bit more urgent than running and tracking them down. And so a few things come into play in that scenario, like what method do they use to get a hold of the provider? Do they call them on the phone, send a text, send an email? How much detail do they include on that message? What's necessary? What feels helpful? So in these scenarios, I'm using this because if expectations aren't clear and they haven't been established up front around how communication should happen, what exactly they should include and not, then staff are really required to use their own judgment in the moment. That's where things sometimes fall apart, and it's not because they don't care to follow the rules or to maintain compliance or whatever, but it's because they care about taking care of the patient. They're dealing with what's right there in front of them, and so they're not really focused on exactly what method or things like that if it's not clearly outlined beforehand. So on the surface, that scenario seems pretty straightforward, right? It's kind of a standard example, but in reality, even communicating about a patient touches multiple HIPAA standards. So we've kind of outlined them here, but things like the security safeguards, minimum necessary, access controls, permitted uses and disclosures. So I don't know anybody who is mentally running through the HIPAA security rule before they send a message, especially in a scenario like this where they need to get a quick update from the provider. So the requirements kind of exist in the background. And let's be honest, that's kind of a lot to expect somebody to reconcile in real time when they're trying to make decisions and decide what the best thing to do. So the policies written at a high level sometimes collide with these real life workflows, because outlining a HIPAA rule about what should be there doesn't necessarily usually translate into what's happening in the day to day. So we'll talk more about that. Before we get into more about that example, I just out of curiosity, this isn't a test, but I want to see in a scenario like that, or when something does come up, something similar, what methods do you guys use to communicate internally? Is it the like secure messaging through the EHR? Are you using email most often? Do you have a texting service? Is it kind of a mixture of everything? Just trying to want to understand kind of how you guys manage this, or what, what methods you guys use in the day to day. So we'll wait for a second for those to come in. I always feel like I should have like a comedy routine ready for while we're waiting for the polls to answer, just so you guys are entertained, but I'll avoid it for today. Oh, I got a laughing emoji. Thanks. All right, so it looks like, I don't know if you guys can see these results, but looks like a lot are using the secure messaging through the EHR, and then kind of a mix of everything. So, and it's kind of what I suspected. The reason I asked you that is because when I talk to people about this topic specifically, it's like they haven't gone down the road far enough to understand what the rule is, what they should be doing. And so to outline it in a way that says, if you deal with this, do it this way, it's sometimes it's a little intimidating to know exactly what the process should be. So we'll talk a little bit more about that, but I want to get into this a little bit. This is usually the point where somebody asks, okay, so is texting and emailing allowed, or is it not? And that's kind of where things get frustrating. I feel like that's when it starts to be like, okay, just tell me the answer. I saw this meme and I thought it was so funny and relatable. So this is about the IRS, the government, when it comes to taxes. So the government, you owe us money. It's called taxes. Me, how much do I owe? The government, you have to figure it out. Me, so I just pay what I want. The government, no, we know exactly how much you owe, but you have to guess that number too. Me, what if I get it wrong? Government, you go to prison. So it's something where I'm using that example because I feel like HIPAA is a lot like that. They don't say this is allowed, that's not allowed, cut and dry, black and white. They say things like implement reasonable and appropriate safeguards, address risks, good luck. And you're like, okay, reasonable according to who? What, instead of things being black and white, it's like figure out your risk, decide what's reasonable in your practice, document it, and stand behind it. Unfortunately, just like the taxes example, if you get it wrong, the answer I didn't know isn't an option anymore. So you're up against a lot when it comes to that, and we'll get into a little bit more. And just to be fair, because I don't want Nicole to yell at me, HIPAA rules are written this way on purpose. So because healthcare practices don't all look the same, there's big, small, more complex, more simple. The flexibility is actually intentional, but the responsibility still sits with the practice or with the organization. So we'll kind of get into this. So when we go back to our example, as you're deciding how to communicate internally in your practice, there's really three questions that they expect you to be able to answer. So the first question would be, what are the risks for us in our environment? So risks might be things like using personal devices, having unencrypted tools, messages being sent to the wrong person, content within that message. What are they saying? How is it being stored? So those are some of those questions you'd ask yourself on what are the risks when it comes to that. They look different depending on the size of your organization, the technology you use, your workflows internally. So that's something you have to identify. And then the next question is, what safeguards do we have to reduce those risks? So once we've defined what the risk areas are, the safeguards could be things like secure messaging in the EHR, like we talked about, having device encryption, having access controls, defining the rules of how to communicate, and then training staff on what can and can't be shared, minimum necessary, make sure that's really clear. And then making sure that they know what tools they can use. So if they are in that scenario, they can quickly decide what and how to get the information out there. So safeguards are how you show you didn't just ignore the risk, that you addressed it somehow. And then the last one is what's reasonable for your practice. So reasonable is not perfect usually. It doesn't mean that you're eliminating all risk. It means you made a thoughtful decision on your reality within your organization. So a small practice with 5 staff is going to land in a different place than a multi-specialty, multi-location group with remote access, multiple systems, a lot of employees. That's where, back to what I was saying, that's where judgment becomes a policy, or where how we outline these things according to your day to day. So not personal judgment in the moment, but documented intentional decisions that are made ahead of the time so that you can kind of plan for scenarios you might run into. The goal isn't to guess correctly necessarily, it's to be able to explain how you made your decision and then what you're doing to support it internally. So hopefully that makes sense. So one of the big things with this example specifically, and I think it helps to go into almost always when we're talking about any scenario when it comes to especially HIPAA compliance, it's like step one, security risk analysis. Almost always. If you're asking any question, trying to define a policy, trying to do anything, it's like first you have to assess your risk. So I want to spend a couple of seconds here just talking about why that comes first, especially with decisions like this. So a lot of practices think of the SRA as like this just annual checklist, some kind of form they have to complete. It's like compliance in other ways, a requirement to check off, or just something that you do once and then move on from. But that's not necessarily the purpose of an SRA. It exists because regulators know that they can't tell every practice how to operate. There are too many nuances within each organization. So instead of prescribing solutions, they really expect you to have an understanding of your own environment and make informed decisions with that information. So the first thing an SRA is going to help you do is identify where PHI actually lives. So your EHR, obviously, email systems if you're sending information, mobile devices, laptops, with third-party vendors, billing companies, business associates, paper records if you're printing things off. So that alone, just doing that exercise is pretty eye-opening for a lot of practices, just understanding where it is. You have to know where it is to know how to protect it. So then the next thing is to help you determine, the SRA is going to help you determine how the PHI moves and how it's shared. So is it shared internally, like this example we keep using with the providers? Is it with vendors? You have to get information to the billing company for them to be able to do the billing. With patients, as you're sharing their medical records, things like that, how is it being shared? So then once you understand where it lives and then how it's shared, you can evaluate the risk of those things. So in that, where could something go wrong? Where are the gaps? What are people like, in what scenarios are they relying on workarounds instead of having a clearly defined process on what they need to do? So that step helps you decide what is reasonable for you in your organization. And it doesn't mean, just like everything else, it doesn't mean it's perfect. It doesn't mean that you've eliminated all risk. It just means that you've made thoughtful decisions based on your size, the structure of your practice, and then your internal workflows. So this is why policies come after understanding reality. So this is something that is we'll talk about a little bit more, but policies aren't meant to define reality, they're meant to reflect reality. So we'll talk a little bit more about that when we get into it. But so on this is where it kind of transitions, and we'll kind of talk through culture and how that plays in. So let's say you've done the work, you've completed the security risk analysis, you've made some decisions on how to structure the policies, how to incorporate that into the day-to-day. And really what it boils down to, and this is something that I don't think that people realize how common, is that no matter how good the policy is, it's never going to answer every situation. You're never going to have a policy that outlines in this, do this, in this, do this. It's healthcare is dynamic. People are busy, systems go down, patients need answers, providers need to know what's going on. So things don't always fit neatly inside a box or within the written guidance that's there. So when someone hits a moment where the policy doesn't clearly tell them what to do next, that's when their judgment takes over. And it really is in the culture. The culture determines whether people guess or whether they ask. So it's like, how scary are you? That's why compliance can never live in a binder or in a document, one document alone in a compliance plan. It has to live in how people respond when things aren't clear. How they respond is determined by your culture. So we'll talk a little bit more about that. So with that, if that's true, the question becomes, how do we intentionally build a culture that supports good decisions over time instead of trying to just guessing and then hiding whatever it was that they've done, it being this intentional culture where we're all working together. It's not about perfection. None of this is about one and done. It's about what happens consistently when things aren't perfect. So it's a system that supports when policies leave room for interpretation, or there is a one-off scenario, or things are moving quickly. Real life doesn't match what it says in the binder, which happens. So think of culture of compliance as a cycle, not necessarily a checklist. We used to say a marathon instead of a sprint, but that would be it's like a repeated marathon over and over again, because it's something that evolves over time. You come back to it. It's not a checklist like a lot of people think it is, I think. So it starts with documenting and creating expectations through written policies, making sure that the rules of how things need to function and flow is written so people have an understanding of what the rule even is. So and then according to their job function, what exactly they are following. The next step is training. Training is so important, and that's where expectations are translated into action. So where they get an understanding of what the information says, what the rule says, and then how they incorporate that into the day-to-day. So that's how they learn what matters the most, how it applies in their role, in their job function, and then what to do if something isn't clear. The next step, and this is how we focus on compliance when we're working with clients, but doing regular assessments, it allows us to see whether reality still matches those expectations. So it gives you visibility into any problems. I think that this is something I hear often is people don't necessarily want to do assessments to understand what's happening in real life, because what if real life isn't reflecting what it says in the policy? It's a risk you face, and it almost always happens because we're human. And so humans sometimes use their own judgment, and sometimes their judgment is not the very best. And so assessing it, going through physical in real life to understand in the day-to-day what the processes are, what processes are in place and what people are actually doing, it will help you have an understanding of where the gaps are, which is so important. And then once we document those deficiencies, and then we can create a corrective action plan. So once you've got an understanding of where those gaps are, what people are confused about, what tends to go wrong, then you can correct it. Whereas if you're never looking at that and never aware of what exactly is happening, then you don't have any guidance on what to correct or how to do it. So that's really what regulators are looking for. When it comes to compliance, they're not looking for perfection. It's process. It's how are you learning when there are issues? How are you correcting them when you find them? And so all the pieces work together. When they do, compliance stops feeling reactive or one-off, or I like to say willy-nilly. It becomes something that supports the practice instead of competing with it. So culture of compliance isn't about eliminating mistakes. It's about knowing that it's normal for mistakes to happen and then doing what needs to be done to handle them. So something we focus on a lot is the 7 elements of an effective compliance program. Um, well, I've made fun of the HIPAA rules being like the other government sectors. When it comes to the 7 elements, this is something where the normally there's no checklist, no specific here's exactly what to do and how to do it. But the Office of Inspector General has provided this guidance, the 7 elements of an effective compliance program. So it's basically what elements should be included, um, what, exactly where to focus these efforts. It's not necessarily, like I said, a checklist, but it's at least a framework that you can use to understand how to build an effective compliance program. So each one of these elements plays a role in reducing the confusion when it comes to these things and then supporting better decisions. We'll walk through each one of them. The main goal with this is to help you, we've talked about the challenges, why it's hard, the responsibility of it. These are what we hope are, practical suggestions on how to build an effective compliance program. So the first element is of the effective compliance program is the policies and procedures. And like I said before, policies aren't meant to describe every situation. They're not going to outline every decision, but they're there to help as far as making things very clear when it comes to translating regulatory requirements into clear expectations and try to reduce guessing in the day-to-day. So at a high level, they should reflect how the organization actually operates. This is something I feel is sometimes confusing, especially when people will get policy templates from vendors or things that they have inherited, very common. It's sometimes like separate. There's a gap between there's this document that says this thing, and then this is what we do in the day to day. What I want to make sure that you guys take away today is that if you have a policy, make sure it describes what you're doing in real life, because if you get audited, the OCR comes in and they're like, "Okay, give us a list of all your policies," and then they see that that's not how things are functioning. The policy wasn't necessarily you can kind of almost get yourself in a worse situation that way. So make sure that they match what's happening in real life, not how you intend to work, but how it actually works. And then that alone will help. It will, when there's a gap between reality and the what's written, that's where the risk really shows up. So they need to be based on that understanding of the risk, going back to the security risk analysis, make sure those decisions are being made, and then that it's appropriate for your organization. So, back to our example, a small practice and a large health system are not going to have the same policies. So if you got policy templates from somewhere that's like they're made for a hospital or health system and you're a small private practice, that's something that you can take it as a framework and then customize it to what you're doing in the day-to-day. So they should be updated and reviewed. We recommend annually that policies are being reviewed and updated, but they need to be updated when workflows change, when technology changes, if you get new systems in place, when risks change, when the day-to-day, the way we work evolves over time too. So we need to make sure that the risks are incorporated in that. And then obviously if regulations or guidance changes, then we need to make sure that the policies are updated with that info. The next element is having a compliance officer in committee. So this sounds a lot more formal than it actually is in real life. For most practices, this isn't a dedicated department or full-time role. It's more of a person it's like added to their already full plate. So that's why the role exists, is to help with knowing what's happening in the compliance world, not necessarily knowing or catching every single issue in real time, but to provide ownership and make sure compliance isn't something everyone assumes everyone else is handling. So like, I don't know, I thought so-and-so was doing it. The committee piece is also important. It creates shared accountability and multiple perspectives, especially since it touches so many departments usually. So you want to have, if the training is handled in HR and the the security is handled in IT, you want to make sure that you've got some people that are focused on those different areas as part of the committee. So the compliance officer and committee are there just to make sure that important things don't fall through the cracks, and especially when everybody's busy. So having the knowledge and expertise, I always use the Hunger Games example. If somebody says that they're listed as the compliance officer, I'm like, oh, you were volunteered as tribute, because it ends up being something where usually you don't have a background in compliance regulations or any of that. You're just really the one who's the point person. And so external guidance and getting experts involved and getting questions answered is something that I always recommend if you're assigned as the compliance officer in your organization, just because it's a responsibility that if you don't know the background and you don't know how to incorporate these things into real life, it comes with risk. And it's something where it's like you don't want to be answering for something that you're not necessarily fully versed on. So I always recommend getting whatever tools and resources and support you need in that role. So, all right. So for our next poll, I am curious. This is kind of moving into the next element, but I want to know, what do you guys think your staff members are most likely to do if they aren't sure how a policy applies to the situation they're in? Some of you are probably like, I don't want to know, but if you had to guess, would you say they would make a judgment call on their own? They would just kind of decide? Would they use a workaround? Would they ask for guidance, or you're totally not sure? Go ahead and answer that, and then we will review those results. I think this question is good. It's an exercise for you too, to kind of assess, like, if you have the policies and you've got, you have the day-to-day scenarios, are you providing support in a way that allows people to rely on those rules, or are there a lot of workarounds? The more workarounds, the more risk, so it's kind of a good exercise for you to think about anyway. So we'll get those results and then we'll move along. All right. That's really good to, so the majority are saying that staff members would ask for guidance. And so I think that shows what type of culture there is in place. And that's the best way to tell, is if your employees feel comfortable asking questions and clarifying, that's the type of environment you want. If they're afraid to not know the answer, or afraid of looking stupid or some of those things, then they're less likely to ask. So I think the more that you can bring in the human component of this, and that we're all figuring it out together, that's something where you can help in that culture of ask questions if you're not sure. So perfect. So training, I believe, and I kind of talked about this, but training is the transition layer. This is where those written expectations are turned into usable guidance for people doing the real work in the day-to-day. So we keep using kind of the same example, but if the policy says use approved communication methods and protect patient information, training is where you would answer, like, what tools do we use here? What technology do we have? How do we communicate internally? What should we avoid? What do we do if the system's down? Who do we ask if we're not sure? So without that guidance, they're, again, we've talked about this, but they're left kind of to their own devices when the policy exists, but they don't necessarily know what to do with it. So let's be real. People are human. They forget. They're busy. They're under pressure. They're trying to be helpful. So good training doesn't eliminate the mistakes that we're naturally going to make, but it does reduce the uncertainty, which I feel like is the bigger problem with that. So when training is working, staff feel clearer, they feel more confident, more comfortable asking questions, less afraid of getting it wrong. Too often you see training as part of a compliance program. We'll see this really often, where it's just kind of a blanket, here's what HIPAA is, here's what the policy says, here's this, but it doesn't necessarily translate in their mind to, here's what the rule is, here's how you follow it. So make sure as you're training people, and this isn't just the annual training that you go through, in the day-to-day, in your weekly staff meetings, in your day-to-day processes, make sure that the translation is happening, and that there's a way to go back to it if things get confused or if they get overwhelmed. We've talked about this, but part of a good culture is having open lines of communication. Guidance from the training or the information that they learned as they're doing their training only it only works if people feel comfortable using that guidance. So most compliance issues don't start as major problems. They start with the uncertainty. Like, I'm not sure if this is okay. I don't know if this process quite fits this rule. This feels off, but I don't know who to ask. So we have to remember people don't stay quiet because they don't care. They stay quiet because they don't want to get in trouble. They don't want to slow things down. They assume somebody else is already thinking about it, or they don't know who it is that's supposed to handle it. So open lines of communication remove the uncertainty. They let it be so people can, whether it's through a hotline or a little suggestion box or something like that, let people ask questions and even allow it to be anonymous so that they feel comfortable addressing issues that might arise. The more you can do that, the more you can get an understanding of and feedback from people in real life, the more you can address these issues before they become a bigger thing. So kind of the point there. We talked about assessments and doing regular assessments. We talked about the SRA. That kind of falls in the internal monitoring and auditing. But as far as how things are working in real life, that's kind of the main emphasis. Monitoring gives you visibility into what's actually happening in the day-to-day to just make sure that the processes reflect the policies. So you're not looking for perfection, just like the other, it's something where you're looking for those patterns. It's not to say, we're completely accurate when it comes to this, we're completely compliant in this way. It's almost looking for what are the patterns that make this fall apart, and then knowing those patterns so that you can address the deficiencies before they become a bigger problem is the main thing there. So we recommend doing assessments once a year at least, in a physical environment. Go through and look and see what we have. A client from one of our dermatology practices that has these little sticky notes, and it's like a little, I think it's like a little dog on there or something, and it says ICPHI. And so she'll go every once in a while and just like, if she sees a piece of paper out or somebody forgets to log off their computer or something like that, she'll go and just like stick it on there. So she gave us a pad of them, and I was like, I'm going to give these out when we see you guys at conferences and stuff, because it's so helpful in the real day to day. What's written is hard to, when somebody, has a human moment and they run to go get a drink or something like that, reminding them to sign off their workstation so that things run smoothly is something that you can help with that process. So when we talk about in compliance, when we talk about enforcing standards, this is where compliance starts to, people talk about it being uncomfortable, because when you hear enforcement or you hear this along these lines, it's natural to think of punishment or discipline. Like, what do I have to do to give the consequences? But in this, so for this example, it's not about being harsh or, pointing fingers or assigning blame. It's more about being consistent. So make sure that the expectations that you have are applied the same way across roles whenever possible. Make sure similar situations are handled similarly. So it's not this one-off scenario, we do this way, but this way. Make sure it's pretty cohesive across the environment, and make sure people know what to expect if something goes wrong. Like, if you're left to decide, here's a few options, give them some guidance just so that you're not left with people running amok. Inconsistent enforcement creates more risk than mistakes ever will. So keep that in mind. If you're not consistent with how the standards are enforced, then it becomes, I'm supposed to follow that rule, but I know nothing will happen if I don't. So effective enforcement actually supports that culture that we're talking about. It shows that the policies that you're putting together matter, that the expectations within those are real, and that the accountability is shared really among the whole practice. So you're not having to take it on your own shoulders all the time. Fair enforcement makes it safer to raise concerns, not riskier. So when you have that culture of everybody's doing their part, then you're more likely to hear about anything that's not sufficient or not being done the way it should be. So that kind of brings me to the last piece, which is corrective action. This is how you respond when you assume that there are going to be issues that happen. Then the corrective action can fix the system. So we're not necessarily trying to fix people, but it's about fixing that system in place. How it's a way for you to say how things are improved after monitoring and after putting the processes in place. So effective corrective action could be things like updating a workflow that doesn't work anymore, clarifying instructions that were misunderstood, reinforcing training where those gaps exist, or even just updating or adjusting safeguards that no longer fit your reality. I talk to people all the time that they've inherited their compliance program. There's way common. People will be like, I don't know, policies in the program, our compliance plan hasn't been updated in 10 years, or it was the person before me that did it. And so when it comes to that, it's like nothing's being adjusted and it's not reflecting, it couldn't possibly reflect what you're doing in the here and now. So this corrective action component is super important, not just for those scenarios, but just throughout the year, throughout time, when you see an issue, correcting it. So creating corrective action plans and documenting them shows your commitment to creating and maintaining a compliant culture in your organization. I feel like that's important because when the OCR comes in or when you're being audited, oftentimes when you can show effort, you can show that you had a plan, that you thought through the risk, that you documented deficiencies, and that you're actively trying to improve in the ongoing. It's something where that speaks volumes, and we've got all kinds of statistics on the different enforcement penalties and how the penalties reduce based on what you do have in place and the efforts you are making. So it is important for you to know that it doesn't have to be perfect. That's why I say it's a cycle, it's an ongoing thing, it's a marathon, not a sprint. So I want to talk about, I know that we covered a lot of different areas. I wanted to just include some quick things that you could start this week. If you're feeling like all of this is overwhelming, you're not entirely sure where to start, or you don't have a program in place yet. We're not saying go in and right now today do a full overhaul, but wanted to give you a couple of things that might help create that momentum. So the first thing that I'd recommend is assign a point person for compliance if you haven't already. Sounds like a lot of you guys are involved in that role, but if not, make sure that there is a point person, somebody who's responsible for keeping things visible. Even if it isn't their full-time job, just make sure you assign a point person. The second thing is to complete, if you haven't already, or revisit your security risk analysis. So start there. It's the foundation for everything else, like we talked about. It provides you with the understanding of where your PHI lives, how it moves, where the risk is in that process. So do that if you haven't already. Review one policy. So you don't have to do every policy in one day or anything like that, but pick one that's maybe in an area where your staff have questions, or it's a question you get a lot, or they're being asked to rely on their judgment. And as you review it, ask yourself, does this reflect how we are working today? And if not, make sure that it's updated with the information that needs to be there. If you're not sure, get some guidance, experts that know how exactly to apply that in the day-to-day. Train your staff on that policy alone. Not this, it doesn't have to be in a formalized way, but I mean, in a meeting, make sure that if you've identified a policy that's not clear and this one that you're updating, spend some time on it. Just get people's feedback. Make sure they understand the policy. Make sure why it matters. They know why it matters, how it applies for whatever they're doing. And then, especially if the situation isn't clear, talk about what they would do in the scenario if they weren't sure how to handle it. I guess the last thing I want to emphasize is the compliance program isn't built all at once. It's built through small intentional steps, just like these that we've shared today. So if there's one thing I hope you take away from this, it's that compliance isn't confusing because you're doing something wrong. It's confusing because it's designed to be flexible, and flexibility requires structure. You're being asked to take high-level regulations and apply them to real people, real workflows, and real constraints, and that's not easy for anyone. So it's not something most of the ones overseeing compliance were actually even trained to do. So a strong compliance program means expectations are clear, questions are encouraged, risks are assessed, and issues are addressed intentionally. If compliance is felt overwhelming or like something you're always behind on. I hope today helped you see that you're not alone, at least relatable. We see the similar issues all the time. But if you ever do feel stuck or unsure of what reasonable looks like, or any of these things that you're being asked to figure out or address, having guidance and support, like I said, can make a big difference with that. So if you find yourself in that situation where you're needing some guidance, reach out to us. That's if you need support. That's our full-time job. So Nicole and her team and our support team is amazing at helping establish and build these and give you tips and suggestions on how to keep an effective compliance program in place. So I wanted to leave it open. I know we're done a little bit early here, but open it up for questions. If anybody has questions or comments or anything that we can answer, um, encourage you to chime in on either the Q&A, or I think you have access to the chat too. I'm always kind of alarmed when there's no questions the whole time. I'm like, did I confuse you or oh, here's one. So the question is, we'd like to toss the outdated versions of our practices compliance policy and rebuild one cohesive program. Is there a template or roadmap HCP has to share? So depends on if we can share some guidance on how to establish policies, how to go through that process. Our program includes, as part of the implementation, we have you meet with, we provide the policies and procedures that you would have there in your practice. And then we have you meet with our compliance experts, our consultants, to review the policies and make sure that they're reflecting the day-to-day, make sure that the updated rules and regulations are in as part of that. So yeah, it is something that we can help with. Nicole, anything you'd add to that on those dealing with kind of those outdated versions or maybe stuff that they've inherited? Any guidance on that at all?
I mean, the only thing I'd say is, outdated version maybe just needs tweaks. You might not need to start from ground zero unless that's really might feel fresh, right? That might feel like the best approach. But things like HIPAA, it's changed somewhat over time. And I think even in one of your slides, Megan, you said, if you're still talking about fax machines and stuff, that maybe it's time for an update. So even just combing through your policies to look for outdated technologies, right? Maybe you need to add an AI policy and all that. So your actual policies might need to be added to, and then some of the outdated versions might still be okay. They just need like a refresh. So, it just kind of depends on your time.
Yeah.
Rebuilding a whole policy from the ground up is a lot of time, but can you take what you have and more just make tweaks to it and update it? That would be the only thing I would say is, maybe start there. But if you decide, nope, these are all just horrible, then yeah, you might need to start from scratch. And like Megan said, we can definitely help you with that.
Yeah, it's definitely something I hear all the time because there's that. It's the unsurety because you don't know what you've inherited. You don't know. It's hard to go through it with a fine tooth comb to make sure that everything is included. And it's that question, I don't know what I don't know. So if you used our guidance, the way that we go about that is to provide you with those templates so that we kind of have a framework so we know exactly what policies we need to get put in place. And then if you just for that factor of not knowing what you don't know and wanting to make sure that you've got all of the policies and procedures that you need to have in place, we can definitely go through that with you. Make sure that you have updated policies, and then our team helps with the updates. So if there are changes to the rules or things that you need to be aware of, then we're obviously being supportive in that process too. So anytime you can outsource any part of that is it's always a good idea, in my opinion. I could be biased, but okay. So our next question is accreditation requirements versus flexibility of policy. What should be the priority dealing with that? Are we talking about HBMA accreditation? Probably compliance accreditation. Nicole, you want to take that one?
Yeah. Without knowing exactly if that's what Christy is talking about here. So let's see, accreditation requirements. I guess if you're thinking some sort of HIPAA, maybe accreditation or compliance requirement. They're actually, you know, within, say, let's just talk about HIPAA, there's lots of things that are addressable, right? Not everything within all the guidelines is a requirement. So I think even just starting there with, okay, what are the actual requirements? And then, yeah, maybe your policy can't be as flexible as you want it to be with some of those guidelines. If it's addressable, then that's kind of thing that's saying, hey, you need to look at your organization and then deal with that. So I guess if you're looking at priority, I would figure out first what things are actually required, and that would be the priority, and then deal with the addressable things, and that allows you more flexibility within, you know, that policy.
Yeah. Yeah, I think that's good. I think that really the question becomes, if there's this listed requirement and we're doing it this way, what do we do about the gap in between? How can we address it? Sometimes people are like, addressable, that must mean optional, right? And it's far from that. So definitely a good point on that. Okay, so our next one is, are there any specific things to watch out for with the expansion of AI? This is a great question. So Nicole, do you want to talk about AI a little bit and some of the things that might be considered with that?
I would say the things to watch out for is if you don't already have an AI policy, you 100% should develop one. Even if you're not currently using any AI vendors within the organization, chances are your staff are using AI. Whether they're using it personally or at work, you may not know. I can almost guarantee you they might be using it at work and you don't know that they are, right? So you want to make sure you're establishing those guidelines, the expectations for how AI can and cannot be used within your organization. And then if you are considering working with a vendor that incorporates AI, make sure that your vetting process is established and that it's being followed. There's a lot of potential for HIPAA breaches and such with AI tools. There are some great tools out there that are HIPAA compliant, but you do want to make sure that you're finding all of that out from the get-go, not down the line when there is a breach and now you're having to kind of recover from that.
We had a question along these lines that maybe we could talk about for just a second. When you talked about the tools that people are using, I think Microsoft 365 is a pretty common one. And there, we had the topic brought up of within Microsoft, there's the Copilot. Is that what it's
Yeah.
called? The AI component of that, which is incorporated into not only the calendar and email, but the Excel and Word and all of those. So is that something where the standard business associate agreement with a company like that covers those different components, or does there need to be something separate for the AI component of that, or is there a way to turn that on and off?
Mhm. Yeah, you normally have to look. So normally like Google or Microsoft, they'll have a list of which of their tools are quote unquote HIPAA compliant. So if you do pay for like that business level, they'll say, here's the tools that we say, if you put the right settings in place, they are HIPAA compliant, and here's the ones that aren't. So you really have to be careful with number one, if you're using any sort of free version of Microsoft, Google, they're probably not HIPAA compliant at all. If you are paying for their enterprise or whatever their next level is, each of those levels have a different variation of security that they will say, yes, we say that this piece of our product is secure. So it just kind of depends, but you should definitely look at your contract with them, look at their HIPAA compliance, if you have a VA with them or if you don't. Some vendors won't even offer one. If they don't, they're not willing to sign one, that would probably be a no-go, you know, most likely. But you really just kind of have to look at each of those vendors and what they say is compliant and what's not. So I don't want to say yes or no for sure, because it just kind of depends on what your contract is with them.
I just think it's something worthwhile to consider because of how many of us are using Excel and some of those tools, and then the AI component being built right into that. It's that's what I meant by technology is always evolving, and so we have to be aware of these, how to regulate it internally.
Yeah.
So, and on the accreditation question, Christy said it's a DME POS company.
Okay.
So,
yeah, so I'm not sure what type of accreditation you're specifically talking about. So like, for example, HIPAA, itself does not offer any sort of accreditation, right? The government's never going to give you a stamp of approval saying you're completely compliant. Now, there's vendors such as us, HCP, or other vendors who will help you go through this process, like go through those 7 elements and give you an accreditation that is kind of just that stamp of approval of like, yes, we are following up with you, and yes, we're helping you make sure you're staying on track for that compliance program. But HIPAA itself doesn't offer like an accreditation. So if there's a specific accreditation you're talking about, Christy, then feel free to throw that in the chat.
What if we had, oh, it's ACHC. I was going to say, like, what if there's like a joint commission or, one of those types of accreditation? Are there flexibility within the policies? So ACHC, are you familiar with that one?
Not enough to probably answer that question well. It probably just depends on what their guidelines are. That's
Christy,
something that we could.
we're happy to answer that question offline. We can do some research for you and get an answer to your question for sure. So definitely reach out to us on that.
Yep.
Another one, if my doctor uses AI during patient encounters, but we don't use patient name, do we need to get a consent form from patients?
So this one gets a little bit tricky. I think there's lots of questions maybe to answer first, but I'm assuming if they're using the AI during the patient encounter, are we talking about them recording the encounter for some sort of transcription or a different type of AI tool? So kind of depends on what the tool is, how it's being used. You also have to remember that patient name is not the only point of what HIPAA would consider an identifier for PHI. Date of birth, date of service, there's lots of other components that could be included there. So again, it just kind of depends. If you have something specific, again, feel free to email us and we can answer that question, based on that specific scenario.
A lot of our guidance is just like what we talked about within here is assessing what you have, what your risks are, what your processes are. And so we can kind of talk through that, that specific question and talk through all of the pieces that touch that. So, but yeah, happy to answer that offline. It looks like all the questions that we have so far. If anybody, we'll kind of give it just a couple more minutes here. If you have anything that comes to mind and want to ask about, we'll make sure that we take the time to do that. But either way, I just want to thank you guys for being here. Thanks for spending the time with us today. If we can be helpful in any way, if you have questions about today's topic or anything that we can help with along those lines, let us know. If you are interested in our support and the program that we offer, we're also more than happy to spend some time with you to get you more information on that as well. I just wanted to mention too, I think we said this before, but we will send these slides that I used today. And then we also have a resource for you on some of the different communication platforms and the ones that we have kind of vetted or can recommend. And so we'll give you that as a resource as well if you're kind of trying to determine how to communicate internally with staff. So. All right, I didn't have any other questions come in. So if anything comes to mind after we've concluded, let us know. Send us an email or give us a call. And either way, appreciate your time. Josie, anything else?
No, that's good.
All right. Thanks. Have a good day, everyone.